So Kristen, why do we review blood pressure every time a patient comes in?
So every time a patient comes in, whether it's 3 months, 6 months, or once a year, we do screen our patients for blood pressure. The reason for that is because people come to a dental office to get their teeth cleaned more often than going to their doctor for a regular medical checkup. So at each visit, we do take your blood pressure with a wrist cuff that gives us a very accurate reading. Healthy is 120/80. When the bottom number is over 90, we do start to get concerned. We will not dismiss you from the hygiene visit if the bottom number is between 90 and 100, but if it is over 100, then it is very concerning that the patient may be in danger of having a heart attack or a stroke. Just a week ago, I had a patient who came in, his blood pressure was 150/90, and it wasn't that high where I would dismiss him. By the end of the hygiene visit, his blood pressure was almost 200/112, which is considered to be a medical emergency. And the patient told me that he started to feel nauseous and lightheaded, so I sat him up. I took his blood pressure a third time, and it was 223/125. At that point, I decided to call the ambulance, and the ambulance came and got him. He went to the hospital. They had him there for 2 days to start to run tests, and then he ended up being at the hospital for a week, and he had 2 stents placed in his heart. And had he gone home instead of me calling 911, he would have laid in bed and possibly had a heart attack or a stroke, and he was home alone. So we don't know what would have happened, but that's why we screen our patients, because sometimes patients forget to take their medication and the blood pressure screening reminds them to go home and take it, or we do detect high blood pressure that was not detected, or we find that the patient's on blood pressure medication but their dosage might not be right and they may need to go to their doctor to be put on a higher medication.